how many drinks is too many drinks? Well, it's time perhaps to ask yourself that question, because doctors and studies now show that weekend binge drinking may actually be worse than regular drinking. This is a story that concerns a lot of people, and we're going to talk about weekend binge drinking and whether it's actually killing you softly on We the People tonight. So what does the World Health Organization have to say about binge drinking? The World Health Organization says that there is indeed no safe limit of alcohol that has been defined. Alcohol-induced liver failure cases are on the rise, and 50% of cancer cases that we see are caused by alcohol consumption, and this is essentially, alcohol consumption that isn't responsible. So irresponsible drinking is linked with 7 types of cancer and has been classified as a group 1 carcinogen. Alcohol also causes around 3 million global deaths every year that have been documented by the World Health Organization. But specifically, what really is binge drinking? Well, studies suggest that 5 drinks or more for men is counted as binging. 4 drinks or more for women is counted as binging. And weekend binge drinking may actually be worse than consuming a small measured quantity of alcohol on a daily basis. This weekend binge drinking is more common typically in the younger age group of 18 to 34, more common in men than it is in women, and it has now been linked with episodes of blackouts, accidents, overdoses. It can cause long-lasting problems like high blood pressure, also linked with stomach infection, and is now being further linked with very serious risks like sudden liver failure, seizures or heart attacks, and increased, of course, with several psychological and mental health issues, increased partner crime, criminal behavior, homicides and suicides. I want to clarify at the very outset that on We the People tonight, we're not talking about alcohol consumption per se, but looking specifically at binge drinking versus daily drinking. What's better, what's worse, what really should be the protocol, if at all there can be one. Well, joining us on the broadcast, we have Dr. Arvinder Singh Soin. He's the chairman of the Medanta Institute of Liver Transplantation and Regenerative Medicine. He is, in fact, a pioneer liver transplant surgeon and a Padma awardee as well. We have Dr. Saurabh Mehrotra, Associate Director, Division of Mental Health, joining us from Medanta. We will be joined by Amit Basantani. He's a liver transplant survivor, a patient who had a liver failure after an episode of binge drinking on a cruise. He's going to join us on the show to share his story. We'll also be joined by Ranjan Dhar, CEO of Shafa Home, India's oldest and largest treatment center for drug and alcohol de-addiction and rehabilitation, and Dr. Sunila Garg, chairperson of the National Institute of Health and Family Welfare, Ministry of Health and Family Welfare, Government of India, also a member of the Lancet Commission and advisor to ICMR and WHO. Thank you all very much for being with us. Dr. Soin, I want to begin by asking you, because we've essentially picked up this story on We the People tonight after a tweet that you put out earlier this week, where you talked about encountering patients who have come to you with sudden liver failure that you believe has been induced as a result of binge drinking, and you went on to say that you're only going to be able to save 2 of those lives. Tell us more.
Rishika, thanks for having me. Yes, last Monday, I think it was, we actually had the odd misfortune of admitting 5 patients to the liver ICU with alcohol-induced liver failure. And 3 of them were too far gone, and 2 of them seemed to be salvageable with a transplant. Actually, one of them is going to have a transplant in a couple of days from now, and the other one's getting ready to have it in a few days. We already lost 2 of the others, and one is fighting for his life. So this was pretty shocking. And the disturbing thing was that all of them had had alcohol binging in the previous 4 weeks prior to presentation to the hospital. So I thought this is something worth informing the public about, and that's why I tweeted to say that alcohol binging can actually be much, much more harmful than anyone imagines. So that's where this whole thing came from. And unfortunately, we've had a spurt of alcohol-induced liver failure in the last 3 or 4 years. Not necessarily linked to the pandemic. Many people say that people were at home and drinking away.
Sorry to interrupt you, but are these patients, what's the typical age group, and also do they have any prior history of liver disease and something that's, perhaps got aggravated because of an episode of binge drinking, or is this purely because of binge drinking?
So we have both kinds. We have people who basically had just episodes of binge drinking and an occasional alcohol drink taken socially otherwise. But we also have people who've been regular drinkers, then they left, and they've taken to binge drinking. And then finally, we have people who may be obese, who may be diabetic,
right,
and who may be what we call confounders, which means that they have multiple causes of liver damage.
I want to go across to Amit Basantani. He's a liver transplant survivor. He's joining us from Mumbai. And Amit, at the very outset, I want to thank you for coming on We the People tonight to share your story. What happened with you?
First of all, good evening. And I would thank Dr. Swain for granting me with second life. I would thank his team for all the good things happened to me after transplant. So thank you, doctor, once again. So my experience with binge drinking was, I started drinking at the age of 33. And I was a casual drinker. I was not drinking regularly, maybe on parties or with some friends, monthly or fortnightly. But the chapter of binge drinking started when I went on a vacation. I went on a cruise vacation for 5 days. There, I opted for an unlimited drinks package. And that was my biggest mistake of life, which I regret till today. It was a biggest mistake which I cannot reverse it, but it was one of the very bad mistake I made. What happened? I was consuming more alcohol, like 10 to 15 drinks a day for 5 days. And when I came back, I was diagnosed with severe jaundice. And at first we thought it will get corrected by observation and small dietary changes. But my condition worsened day by day. And eventually I became so weak, so frail. And after 4 months, I went into a pre-comatic condition where I forgot the name of things. I couldn't remember my brother's name. A small chapter of that happened. Right. So I was immediately admitted to hospital. There I was prescribed by doctors to immediately go for a transplant. And I never thought me having an unlimited drinks package would end up having a transplant. So just a small mistake of drinking more alcohol for a few days can harm the liver very badly. So I regret that decision. And eventually I was blessed to go to Dr. Swain and I was operated at the time of Corona, the first COVID lockdown. I was operated at that time, 15th May 2020. I was operated by Dr. Swain and his team. And my donor, my wife, donated the organ. So it is very traumatic for family also. So
well, Amit, we're glad that you're well. And like I said at the very outset, thank you very much for coming and sharing your story because, like you were explaining, you don't have any prior history of or a predisposition, or predisposed liver condition. And yet it was this one episode of binging that actually landed you in the situation that you were in. And you were very lucky, like Dr. Sohan said at the very outset, that there are several people who don't make it as far as you have. So like I said, thank you for sharing your story. Dr. Sureela Garg, if I can come to you, I mean, look at what the studies suggest. And at the same time, this isn't something that we really talk about. I mean, everybody talks about the perils of alcoholism in general. But, can we, with a certain degree of certainty, you believe, say that binge drinking is actually worse than daily drinking? And, if somebody is a preferred drinker and enjoys a couple of drinks, perhaps phasing it out is a better option than, just binging over the weekend?
Thank you, Rishika, for having me on the show. And first of all, I'd like to say that definitely you pointed out very rightly that we focus on alcohol as a whole, particularly when we are seeing huge burden of non-communicable diseases in Indian context and where we have got a task force also for that.
Yes.
But, it is very important to focus, on the binge drinking. And then when we talk about binge drinking, we do not only talk about, the males part, we have to talk about that from a gender perspective.
Yes.
That is also very, very important. And we need to talk from the youth perspective. If we see, our own data, as much as, if I've seen and reviewed that 15 to 25% of our adults, our adolescents, they start as early as 15 years. So this is where when we talk about social drinking, it actually then, converts into binge drinking. And this is one thing which needs to be focused upon. We overall say, but we have to be very, very focused in context of binge drinking, that how dangerous and how harmful it is, whether it is talking about, finer moments, coordination, or anything when we talk from head to toe, and particularly when Dr. Soin talked about, the liver diseases and cancers and all that. Apart from this, basically even the existing medical conditions are exacerbated because of this. So we need to definitely be very specific and talk about the dangers of binge drinking. That is important.
Right. Dr. Saurabh Mehrotra, I want to come to you because, this is not just a physiological problem. This is not just something that has, physical manifestations or ramifications. This is very closely associated with a person's mental health. And I'm not just talking about the mental health aspect of drinking or binge drinking, but I'm also talking about the psyche of the person who believes that it's okay to go out and have a couple of drinks, over the weekend with friends, as long as you're not drinking through the course of the week. Does that mindset in a certain sense need to change?
Thank you so much. Absolutely. Most of us actually believe that having a couple of drinks over the weekend or more than that, or binging over the weekend is not so much of a problem. So that needs to be busted. That's a myth. We now realize that binge drinking is actually a huge, huge problem. We are seeing it more so in the younger generation, 15 to 44 years, of age group. It starts pretty early, and it's used for various reasons. For example, evening parties, vacations. People see it as an outlet for stress, anxiety, depression. So people going through, difficult phases in life believe that having alcohol, relaxes them. It helps them overcome their stress, anxiety, makes them sleep better. So this is how people, get into this binge drinking. Of course, people want to achieve a high. So instant high, that's what they believe. So all of these factors contribute to, binging and binging increasing over a period of time.
If I can just come to you, Mr. Dhar, at this point, because, you work in alcohol and drug de-addiction. Can you, for certain, point towards trends? Because, like I said, the conversation tonight is not generic about alcohol addiction. It is very specific to binge drinking. What are you witnessing?
Thanks a lot for having me. The basic idea is about the socially getting acceptable. That's the biggest problem. Mm-hmm. Those parties which we are talking about, and then the weekend parties we are talking about, it's only because alcohol is socially becoming acceptable. Then when you come to binge drinking, people don't know how to, handle their drinks or how much they want to take. So it goes on and on and on. The quantity keeps on increasing. As the quantity keeps on increasing, the problems in your day-to-day life start, and then the problem is not only with the medical part of it. I don't know why we are always talking about the medical side of it. Yes, medical side is a big problem, but it's a medico, psycho, social, and spiritual problem, or the four major parts of an individual are affected, and then the problem becomes complex. You don't know which part you are taking care of. Suppose I have had people who had a transplant. They come back to us and get treated again because, they are on the verge of death. The poor wife or somebody from the family has given up the donor has given them the part of their liver. but they don't care about it. For them, it's drinking becomes more important. So the point I'm trying to make that the treatment is very important. It's not about the supply part of it.
Right.
The more is for the demand part of it. So the demand has to be controlled, because as long as it is socially acceptable.
But how are you going to control? I mean, there are several questions that one can ask you, but I think it's important to just be aware of the ramifications. And I think, that's where, Amit, your story is really important. And if I can come back to you at this moment, because, you were narrating to me earlier how, it was almost miraculous how you managed to get a liver transplant in the middle of the COVID lockdown when airports were not open. You made your way from Bombay to Delhi. You managed to get into a hospital, with a negative COVID test, and you got a transplant. But, this is the question. Is there enough awareness? Do we know the dangers of binge drinking? Do we talk about it amongst peers, or is it, let's say, the unpopular conversation to have?
Normally, people believe that having few drinks doesn't matter, or regular drinkers will be affected by the diseases like liver failure. But I am the setting example of this thing. The binge drinking really harms your liver badly.
Right.
So people should really avoid happy hours, unlimited drinks package. Normally, these are all marketing gimmicks. So you are forced to drink more, buy one, get one free. You should avoid getting trapped in this kind of marketing by hotels. Especially, yes, tell me.
Yes, it's very interesting that you say this, because, there's no safe limit to alcohol that's been defined by any of the studies or even by the World Health Organization. The question very simply then, Dr. Soin, is regular measured drinking, and whatever you define measured as, is that better than binging?
I think I'll be very clear and slightly unpopular at saying this, but no alcohol is actually good.
Right.
Except, the point is that if you say that people say that if you have a glass of wine every day or 5 days of the week, and that's good for your heart and it vasodilates the vessels and all that. I mean, 8 out of 10 people will actually become habitual in drinking. So that is where the problem
I don't think anybody is making a case for alcohol is good for you. But at the same time, I think like Dr. Saurabh put it, that it is a way to, sort of mentally take a break, or, go. It's also a social tool. It's also what you do among friends. It's to give yourself a break, sleep better, etc. So, if that is the case, and if we're not making an argument that, okay, this show is about telling you that if you drink, you're going to die. The question then, I'm sure that viewers have is it safer perhaps to have 2 drinks every day or every other day as opposed to having 5 drinks over the weekend?
So you're not going to have me say that any amount of drinking is good, whether it's through the week regularly or as binge drinking.
Right.
It's very clear that I have had people who had as little as 6, 7, 8 units a week and unit is like, 1 unit is 1 drink.
Yes.
6, 7, 8 units a week for like 5 years, 7 years, and they have bad liver disease. So, it depends on the individual.
Yes.
And no amount of drinking can be recommended, to be honest. Right. Rishika, you'll be so shocked if you read the replies to my tweet. There's a 20-year-old who sent a reply saying it must be bad water, it must be desi alcohol, because I and my friends, he said in the reply that he and his friends drink every weekend and they have like 6 shots, 10 shots. So the youth of today are very misinformed. So, this program is totally on the spot. You have to tell them this is a bad thing.
Well, Dr. Sunila Garg, is there such a thing as good alcohol? I mean, many say that the quality of the alcohol makes a difference. Like you said, people associate disease with the quality of alcohol. Is that a fallacy, or is there some truth to it?
No, there is no truth to it. I am also with Dr. Arvinder Singh that there is something, there's nothing known as good alcohol. We need to bring this thought to the youngsters, because I feel that, it is the peer pressure also which makes a very important thing. And somewhere there's a thinking that we are going out on a holiday, we must drink, kind of. If we are meeting friends, and then there is no limit to it, kind of. So, it is not a harm reduction strategy. And as, has been pointed out earlier, that we start initially as a social drinking, then it ends up, over a weekend as binge drinking or over a holiday. So I feel it is very important that the message should be loud and clear that this is one of the important factors like tobacco, which is contributing to the risk of non-communicable diseases. And particularly if I was to talk of diabetes, hypertension, stroke, or cancers. So all these factors, when you look at the risk factor behind that is, two important risk factors. And one of them is alcohol, which we need to, kind of focus on in a big way.
Dr. Soin, couple of quick questions that I want to ask you, because like I said, we've highlighted part of the problem on the show, but I think it's really important to then answer some key questions. So if we could just get that big question graphics up. One, of course, does detox help?
No. So no amount of lemon, milk thistle, artichoke, herbal meds, nothing is going to detox the liver in terms of the damage the alcohol has already caused.
Okay.
So really you need to stay away from it. But I mean, if this helps, I'll give you some little advice. One is, of course, that you shouldn't drink rapidly over an empty stomach. If you're going to have one or two drinks, then it's best to eat something and then have one or two drinks. You should not mix your drinks. Those are the only two things. And you should have enough water, like non-alcoholic liquids along with it.
Who is at a higher risk, and what is it that social drinkers should be aware of in terms of, pure physical symptoms?
People who have tendency to fatty liver otherwise, or who have a liver disease because of viral hepatitis, or who have diabetes, bad lipids, obesity, who already know that they'll be probably predisposed to having a fatty liver, they should completely stay away from it.
Right. And, like we said at the outset, this is not just a problem that we need to talk about. I think, Ranjan Dhar said that we need to stop talking about alcohol in the medical sense. So I have to ask you, Dr. Saurabh Mehrotra, what are the red lines as far as you are concerned? What do social drinkers need to be aware of? Where do you think you've sort of tipped a line and perhaps need to seek help?
Okay. So to begin with, I'd like to reiterate what everybody here is saying. Alcohol is best avoided. No amount of alcohol is safe or, for that matter, beneficial to health. So that's the most important point. Now, if people do drink socially, they must be aware of what are the so-called moderate level of drinking, which is not more than 2 drinks in a given day. So they must be aware of the fact that the drinking has to be very limited, right? They must be aware of their own vulnerabilities. Now, people do not realize their own vulnerabilities. Vulnerabilities could be in terms of physical vulnerabilities, physical ailments, as Dr. Soin just elaborated, and vulnerabilities could also be psychological vulnerabilities. So what we invariably see is that people have a history of social drinking over a period of years where they still manage to control the intake of alcohol. But a stressful life event happens and all of a sudden the drinking skyrockets. So there's a clear association between stressful life events and a spike. And many of us are psychologically more vulnerable than others.
Right.
What social drinkers also need to understand is that the body physiologically over a period of time develops tolerance. So if you are drinking, if you're having a drink or two at best every day and you continue to do it, you will no longer have the same effects over a period of months or years.
Right.
So the body develops tolerance, and if you want to get the same kick, you will ultimately have to increase the consumption. And this is how it just spirals and goes out of control for most people.
Well, I think you've put it really well. And, like I said at the very outset, this is perhaps an unpopular conversation to have, but one that absolutely must be had, especially after you've heard the stories that Amit has had to share, heard the stories that the doctors of the broadcast have had to share. I can't thank you all enough for joining us in this really important conversation.